As we age, it's pretty common to have pain in the fingers and the hands and start to lose mobility.
And we will show you 5 essential exercises to keep your hands feeling younger and more mobile.
What do you know about it? You're pretty young yet.
I'm kind of old.
Right. Now, when I was 57 a few years ago, I experienced an early morning wake up and my hands, for some reason, became very stiff, especially my right one. I could not even make a fist. Now, this continued on for a number of months. It was to the point where when I shook someone's hand, I didn't want to, because when they squeezed my hands, it hurt. It was painful. And I decided I gotta do something about this.
One of the reasons your wrist and hand can become stiff is because there are 27 joints, 34 muscles, and over 100 ligaments involved in your hand. And arthritis is a primary factor for many people's issues.
And luckily, that can be dealt with, and that's what I went after. Okay, the first approach is to loosen up and keep the wrist mobile. Now, we're going to do that with simple exercises to start with. Flexion and extension, like you're waving goodbye without moving your arms. Okay, then a loose fist on both hands and just make circles. Now, you're going to feel your joints pop and crack a little bit. If it's painful, work with it a few seconds. Typically, it will loosen up. If it doesn't, it gets more painful. You're going too much too soon. Now, after a few days, that should loosen up. Now, this next exercise is decompression. It's a little more detailed, and only do this if it feels good. I'm going to show you a close-up on how to do it. So with this exercise, as we grasp here, stabilize the hand, relax the right arm, and then pull. Get that joint to pull apart. It's traction is what it really is. And while you're relaxed and pulling, this takes a little practice sometimes, you rotate just the ulna and the radius, these bones right here, and you can see them move. Now that gaps the joint, helps synovial fluid get into the joint and loosens that wrist up. It's a complete exercise for the wrist.
Okay, the next exercise Brad did was for his fingers. So what you want to do is make a fist if you can, and then open your fingers all the way. This is going to be finger flexion and then finger extension. Now, some people's fingers may be so stiff they can only get part way down. If you feel comfortable, simply place your other hand over and help close gently. Don't force it. If it hurts, that's too much. This will help stretch it a little bit more into flexion. Now, if you are stuck extending or straightening your fingers out, you can try putting your hands together like you're praying, and the pressure from the other hand will help push it straight. If you're at this range and can push more, you certainly can go either direction.
Right. My problem was flexion. I could not make a fist with my right hand. Within a week, things got much better. All right, now the next thing we have to address in a unique way is the thumb. It's that opposing finger. It gets more stress and oftentimes gets more arthritic pain than the other fingers. So what we're going to do is start out the joint here and work our way up to the end of the thumb. So the metacarpal mold, we'll call it, we're going to actually grab this bone from here to here, and we're going to move it back and forth so we isolate the joint here. You can go this way. You can do circles. You're going to work whichever way it feels more comfortable, and then you work the more painful directions after you work the more comfortable direction. So this way might feel good. This way, ow, we work the pain-free side or the less pain direction, and then we go to the more painful way. Don't go too aggressively. Then after that joint is addressed, we're going to do that for about 15 to 30 seconds. Then we'll go up to this one, grab up here, and simply, this joint only flexes and extends. It does not go sideways, so we don't have to worry about that. This way and here, you can see it flex, and we go straight. There's not a lot of motion in this. You can't put a little traction, pull out, and do it. That can be very helpful. A little trick of the trade from us therapists. And then we're going to go to the thumb. Now, this joint I've worked with, and it worked really well. At one point, I couldn't bend it past here. And after about a week, maybe into the second week, I could flex it and fully extend it. And again, you're going to spend about 15 to 30 seconds on each joint, maybe a little more. It'll really help that thumb loosen up.
All right, this next exercise is going to target your MCP joints, or often referred to as your knuckles. So in order to do this, you're going to try to keep a straight wrist and hand, and you're just going to bend at that joint, keeping your fingers straight, and then you're going to extend back up. Now, when I broke my hand many years ago, this was actually pretty challenging for me to do. I couldn't get down all the way, so it takes time, but it can work.
So typically 10 repetitions, 10 to 15. And also, if you want to go a little step further, or if you have grandchildren, you can do the claw. Seriously, you go like here, and then you claw in. It gives you a little extra range and or function. So anyways, work with that. I personally never use this one because it didn't really help me, so I put that one off to the side. Only to do the ones that really seem like they're benefiting you. We're going to talk about when to do these in a little more reps in a bit. And now this last technique, we're going to actually address the muscles, the intrinsic muscles in the hands, and all of those ligaments that we talked about earlier that Mike mentioned. And we do it simply with a hand massage. Now, the problem with this hand massage, well, first of all, I'll demonstrate it, then we'll talk about the issues and challenges. Oftentimes, the thumb, you're going to go between the joints and the bones down in here, and you can just work those and go between each one at a time. I'm going to work between the pinky and the ring finger here and in here. And this should feel good. You're going to work it till you get a little tired and go to the next one. The problem is to get in deep to the muscles and the ligaments, you have to push fairly hard. So that means this thumb gets a workout. Now, assuming you probably have maybe some arthritis in this thumb, and that's why we're doing this, this may not be the most practical solution unless you have a family member or a friend who's going to do this to you. That can be very helpful, or go to a masseuse. The one that's really important is there's a lot of muscle between the thumb and the first finger, and this area, you can really work that muscle good. It's going to increase circulation, loosen up those joints, and offer some really good relief. Now, the option you can do is if you want to go ahead and have a massage gun, one that reciprocates like this. This is our Q2, our small one. It actually is ideal for this situation. There are 5 heads that come with it. You're going to use the head like this. It's pointy a little bit and rounded, and it's going to go right into those muscles. Put it on low. Don't do it too aggressive. And you can see it working there, and you just work it around as it feels good. And work them one at a time, all the way up. Now, the nice thing about the gun is it has all these other heads. You can use it on other parts of your body, your legs, thighs, whatever it may be, the wrists and the hands. Sometimes that's a good thing to relax as well, as because these muscles here control your hands, and they can get tight as well from the pain. I just ran out of breath.
I noticed.
It really does help. All right, so I did mention the time of day or how to do these. Typically in the morning, and we all know this, is when you get up, the hands are typically as tightest and more painful than any other time of the day, unless you're really working them hard. So don't do the exercises immediately after arising out of bed. Get up, move around a little bit, get them moving slowly, and then start the stretches maybe after you've been up for a half and an hour. And then work those. Again, only do the ones that really seem like they're benefiting you and not creating sharp pain. It'll work very well. You'll know exactly what to do.
If you want to watch more videos about how to work your hand arthritis or pain, we got some right here you can click on. Put it over Brad's face.
No,
He's gone.
It's probably a good idea.